You're about to undergo a surgery for a total knee replacement. Your consultant will have explained to you why you need to have the procedure. This short advice clip is here to help you in your preparation for your operation. Most surgeons will want you to start moving your knee as soon as you wake up from surgery. Your knee will be swollen, which will cause stiffness and weakness in the joint. A physiotherapist will visit you on the ward and teach you some basic exercises to start bending, straightening, and strengthening your knee. The exercises will likely be similar to the ones you're watching. The sooner you start these exercises, the better chance you'll have of a successful recovery. You may be advised to use ice on the knee to help with your swelling. You may find it helpful to ice the back of your knee too. Swelling tends to sit in this area and cause you pain and restricted movement. If you've had a straightforward knee replacement, your medical team will want you to start walking on the first day. This is to reduce your risk of complications following surgery, such as a blood clot, chest infection, or skin sores. You'll most likely need to use a walking aid when you start to walk. The following videos show you how to use a rollator frame and elbow crutches. Both videos are based on the assumption you're able to put some of your weight through your leg following surgery. Stand up straight with both hands on the frame. Push the frame away from you before taking a step forward with your weaker leg. Bring your weight onto this leg, ensuring that your knee stays strong and straight with your hips pushed forward. Step the other leg forward to join your weaker leg. Your feet should be level before you start again. Stand up straight with your elbow crutches by your side. Place your elbow crutches, one at a time, approximately a foot in front of you. Step your affected leg forwards onto an imaginary line between the two crutches. Step your other leg to join it. Continue this sequence, keeping your gaze directly ahead. Going up and down stairs can seem daunting, but with some helpful tips and some practice, you should find the task achievable. You'll need to be able to use at least one elbow crutch in order to do this. The following video, again, is based on the assumption you're able to put some weight through your leg. Place your good leg on the step first. Next, bring your other leg to the same step. Finally, bring your crutch up to join your feet on the step. Repeat this sequence for each step until you reach the top. Walking downstairs. Hold onto a rail and use elbow crutches as needed. When going down the stairs, follow this sequence. Place your crutches on the step you're going to move down to. Next, put your weakest leg down on the same step. Finally, bring your other leg to the same step. Repeat this sequence for each step until you reach the bottom. Finally, for you to get the best outcomes from your operation, it's advised to practice some basic strengthening and stretching exercises prior to your surgery. Try the following exercises at home. Note if any of them cause you more pain or inflammation, stop the exercises and contact your physiotherapist. Aim to do each exercise 10 times up to 3 times a day and hold the stretches for 10 seconds. Sit upright in a chair and place the heel of your affected leg on a stool or table. Make sure there is a gap between your foot and your hip as you try to straighten the affected knee as much as you can. Stay in this position and hold as directed. Sit in a chair and bend your affected knee back as far as you can. Place the ankle of your good leg over the front of your affected leg and use it to bend your knee back further. Hold this position. Lie on your back with a foam roller or rolled towel under your knees and let your legs hang over in a comfortable position. Straighten your affected knee by tensing the thigh muscles so that your heel comes off the table and the knee straightens. Hold this position. Then control the movement back down to the start position and repeat.